Hi there, baby nurses. Thank you so much for once again joining me on yet another episode of Introducing Solids to Babies, which is just an extension or a part two of nutrition on our notes. So, when exactly do we start introducing solids to babies? We know that it is around 6 months. And why do we encourage parents or caregivers to introduce solids to babies at around this time? The main reason here is at that moment, the baby's digestive system has also developed, is more developed, and they start to show signs of readiness. You will see this now. They can also sit with minimal support, and they can now control their tongue reflex. When you put something like food in their mouth, they can control how to put it inside and test it rather than just pushing it out with the tongue reflex. So now they can control their tongue reflex, and we'll see that at that moment they start showing interest in your food as well. They start to grab and look at you and stare when you're eating. They want to understand. They're really so curious about what exactly that you're eating. And you can tell, and they can actually show that they want it. They also want to test it. They also want to experience whatever it is that you're experiencing at that moment with whatever it is that you're eating. So that is exactly a sign of showing readiness. So now that we know when to start introducing solids, the question now is, how do we start introducing solids? So I'm going to advise you to introduce solids with single ingredient foods like single grain, iron fortified baby cereals. I'm sure we are all aware that is the reason why many babies at this moment in time, they start eating a cereal because it is safe. It is a single grain cereal, and it is also iron fortified. So how are we going to prepare this cereal? It is either we're going to prepare this cereal with breast milk, or we're going to use the baby's formula. While we are so excited about introducing solids to our babies, there is also one thing that we need to keep in our mind, which is hygiene. We need to remember at all times to wash our hands, to sanitize and sterilize the baby's equipment and utensils at all time, in order for our babies to be able to fight any kind of diseases that may attack them. So we need by all means necessary to help, as I said, help the baby to thrive by keeping away any kind of harm or any threats to the baby that is going to hinder or disturb them from developing well. And this is also one thing that is going to disturb them in terms of their development at this stage. So we also need to be just careful and know that we are excited about introducing the baby to solids, and we also need to be very careful as well. So how do we introduce? As I said, we need to gradually, after we have the babies have started eating their single grain foods, which are mixed with baby formula or with mother's breast milk. Now we can gradually introduce pureed vegetables and fruits. Yes, we can do that, and we have to do it gradually. It doesn't have to be way too overwhelming for the baby. We start with mild options, and I'll give you examples which are like sweet potatoes, peas, apples, or even bananas. And remember to keep the consistency smooth and easy to swallow. Yay! Congratulations, baby nurse. Now that you know that your baby has graduated from the single grain cereal to the softer options, the pureed veggies and fruits, now you know that it's time for you to introduce more textures. Yay! Introduce more textures as the baby gets used to solids. Remember, do not overwhelm the baby. introduce one food at a time, because we spoke about we need to be very careful about allergies and intolerances. So it is very safe and easier for us to introduce babies to one food at a time. If you want to look at those notes, you can always go back on your notes and you always find more detailed information about allergies and also intolerances. We also need to give babies smaller portions as well. Remember to have proper portion sizes. I know that we are so excited now. Our baby can eat almost everything, and also the baby is also very excited, very keen to test a lot of other different things, textures, tastes, and all of that, all of the good stuff, right? And we might even get lost in terms of giving the baby proper portions as well. It is also very necessary. So we need to remember that as well, that we need to give small portions at a time. And once we have done that, we need to pay attention to the baby's cues. Now that the baby is developing and now that the baby is starting to eat food, they will also show you signs of telling you that, oh, okay, I am full at this moment, I don't want any more. And we don't need to force feed the baby at this moment. They are full. Just like you, when you know that you're having a special meal, whatever it is that you're eating, and you feel like, no, I can't take anymore, I am full. Please don't force the babies when they are full. Listen to them as that's how they are telling you. In case you have no idea whatsoever how to tell if the baby is full, okay, it is so easy to see the baby when the baby is full, because they are going to show you disinterest in the food. Remember, they show interest when they are hungry, and now they are going to give you the opposite, less interest in the food whatsoever, clenching of the teeth or their gums, or pushing out the food as much as possible. Now they are not even taking the food or allowing you to put the spoon or to feed them anymore. At that time, you will know definitely that, okay, and they're even pushing or moving their face away from your food or your face or the spoon. Definitely, you know that at this time the baby is full and you don't need to force feed the baby. Great job, baby nurse. Now that your baby has passed through the stages of the cereal, and you have introduced them to the softer options, the pureed vegetables and the fruits as well, and you have introduced the more texture in their diet, you also need now to introduce water as well, because it is very crucial. Yes, I know they are breastfeeding or they are also still formula feeding. You also need to introduce a sippy cup. You introduce the sippy cup with water. It is so much easier to do it that way, to encourage the developmental of drinking skills. Now that we have succeeded in introducing the baby to solids and also introducing the baby to a sippy cup, firstly with water, it is now high time that we also keep in mind that we need to introduce and keep feeding the baby appropriate food choices. What exactly do I mean by that? Remember, we spoke about giving a baby a balanced diet meal, meaning we are going to keep giving the baby iron rich foods, continue with the iron fortified cereals for breakfast in the morning, and give the baby pureed meats at this time, pureed beans, and also continue with the vegetables and fruits. And we also need to give a variety of different colored vegetables and fruits as well, to ensure that the baby receives adequate nutrients from a range of vegetables and fruits. And you also need to introduce whole grains like brown rice or wheat as well. And you can also introduce dairy at this moment, but you need to introduce a plain yogurt which is full fat at this moment, and you can also give cheese to the babies. So milk at this moment, cow's milk, is a no-no. I believe that at this moment in time, the topic of nutrition and introducing solids to your baby has been much clearer right now. And in case you were worried and you were stuck and you didn't know exactly how do you go about with this process, now things are a little bit clearer to you. We can always have more notes here and there. We're going to tweak some of this notes in terms of nutrition. Whenever there is more things that you need to take up, look out for those notes as well. Thank you so much for having me and spending time with me. Catch me on the next episode. And hey, by the way, if you're watching me for the first time and you're wondering who exactly I am, my name is Tuli James Lalazi. I am a mom of two amazing boys, certified life coach, diploma in nursing. I love educating women and empowering women. Hence, I started a nanny training agency in 2016, and ever since then, it has been up and running. And I enjoy educating women, empowering them starting from exactly where they are, from them being a nanny to being a specialized newborn care specialist to even being a qualified carer in all different areas of caregiving actually. So if you are confused and you don't know exactly where do you want to specialize in, I'm always here and you can always get in touch and we can take it right from there. See you in the next one.